On today's vlog, I want to cover 5 alternatives to the semaglutide shots for weight loss. And we're going to count down to number 1. So number 1 is going to be the best choice. We'll start with number 5. Number 5, the 5th alternative to the shots for weight loss, is crack. I know what you're saying. It's illegal. Okay, there is that. And keep in mind, with all of these suggestions, you should talk to your doctor first. But seeing how the shots that people are currently taking have so many side effects, and there's a lot of people with disasters, and there's a lot of people who are having no symptoms at all, but no clear exit plan, and sometimes it's costly, and maybe some of those horrific side effects are accumulating the longer they take it. Given all of that, these other alternatives might actually make more sense. A little bit of crack is going to increase your metabolism and suppress the appetite, which is the whole purpose behind these semaglutide shots. It suppresses the appetite and you eat less and then you lose weight. Crack can do the same thing. Now, I'm not saying that you have to become a crackhead or an addict. Microdosing, small amounts of crack, before the point where you start to lose your teeth and your livelihood and not show up for society. Way before all that, a small amount would actually give you the same results. And all joking aside, amphetamines used to be prescribed for this. Amphetamines, your ADHD medications, are effective at weight loss, for sure, without a doubt, all joking aside. These medications increase your metabolism, kind of spin up your hormone system. They do tax your adrenal glands, and there's no exit plan, and there is some likelihood of rebound weight gain. That is part of the problem there. But people definitely, while they're on amphetamines, they are wired, their appetite is suppressed, they lose weight, and they get the same benefit. It doesn't really affect the GI tract the way the semaglutide shots affect the GI tract. And really, we're just looking at diminishing returns. So a lot of times the people who are on amphetamines need higher amounts to maintain the benefit. But once again, this could be done with staggering the amounts or doing cycles where it's a moderated amount. This would have to be talked about with the prescribing doctor, but good luck having a doctor do this for you. But there are doctors who will. Personally, I wouldn't touch those medications, but I would rather do those than the semaglutide shots. For that matter, cocaine probably would be in the same category. Okay, the 4th option as an alternative to the semaglutide shots, we could say smoking cigarettes. And smoking cigarettes has gone out of trend, and for a lot of good reasons. It's linked to nearly every form of cancer, as well as cardiovascular risks, direct problems with the lungs, but it cooks the blood vessels and causes all kinds of problems. But people who smoke cigarettes do have a suppressed appetite, and for that reason, they lose weight. It used to be one of the techniques that the models would use to suppress their appetite and keep the weight off so that they could keep their figure for professional purposes. Smoking cigarettes, who knew? It's like a forgotten technique that has some value. I would choose smoking cigarettes over the semaglutide shots because you could smoke cigarettes for decades without having any real major problems. The problems really are long-term risks, and those could be minimized if you switch to an all-natural cigarette like the American Spirits or something like that, where the chemicals are removed and you're just dealing with tobacco. In this way, you would get all the benefits of the appetite suppression without the added chemicals, for even a greater likelihood of benefit to risk ratio in benefit of using it. Keep in mind, I don't like smoking cigarettes. I think personally, I don't like the habit. I think it's disgusting, but I think that would be something I would choose over the semaglutide shots personally. Once again, discuss this with your doctor. Okay, alternative number 3, we're going to call this good old phentermine. Now, phentermine became really popular a while back for weight loss. And the challenge is that it also has a bunch of side effects and complications. As it turns out, we're just not supposed to take drugs as human beings. Drugs disrupt the body. They don't repair or improve the normal physiology. So drugs are always going to have a side effect. That's just a fact. But a lot of the patients that I've seen that were taking phentermine suffered a lot of irregularities to their heart. Their heart rhythm oftentimes needed to go on medications like beta blockers to correct it. They suffered high anxiety, and there really isn't an exit plan that's that clear. So the benefits were there, but I wouldn't call this one I would entertain just because how it messes with the heart. Okay, alternative number two is going to be the triple stack that used to be popular. Think of like products like Ripped Fuel, that was an over-the-counter supplement. Metabolite, I think, was another one. But these were products that had ephedra combined with caffeine and aspirin. And this triple stack actually was thermogenic. It increased your metabolism while at the same time being muscle sparing. It literally melted fat. It was fantastic. People used it. The gyms, flocked to it. People would use it because it also had the effect of like a powerful stimulant. It really was all the rage. Problem with the triple stack, and the reason why the FDA stepped in and banned it, was because people were having strokes as a result of taking it. And for that reason, I wouldn't recommend that approach, although it's a valid option considering the risk to benefit ratio of assessment is not all that much in favor of the semaglutide shots either. Just something to think about it. Talk about it with your doctor. Okay, the number one favorite alternative to taking the semaglutide shots would be the reset food plan combined with holistic care. Treat the underlying cause, decongest the liver, address any vascular inflammatory events, stabilize the hormone system, including the thyroid, even if it's subclinical, and then follow a food plan that slowly, gradually gets your body burning fat. And then once you're there, learn how to exercise in a fat-adapted state. And then the key is going to be fasting. Once you're able to start fasting, then the fat will melt off. But the key is to first address that fat adaptation so that the cravings are gone and the appetite is corrected and you're no longer struggling to do it. The reset food plan, of course, has phases, so it's gradual. You get to fasting slow so you don't push too hard and trigger that kind of survival mode where your adrenal glands are making stress hormones and producing sugar to get through it. We're avoiding all of that by going slow while treating the underlying root cause of the particular person. Each person's different, but it's very successful. And there is no shortage of examples of people, whether in our practice or just out on social media, who have lost so much weight, lowering their carbohydrates, going either into keto, carnivore, paleo, South Beach diet, Atkins diet. All of these things have some similar overlapping themes. The main one is that they had to get their cravings diminished. That is what the semaglutide shots do. We're dealing with massive food addiction. And if that's not addressed, you're not going to be able to do it. The other common denominator with all of these success stories is that all of these people really adopted a change in their mindset. They didn't want to just white knuckle it, lose weight, and then go back to eating pizza. They understood that they were going to give up the pizza, figuratively, and maybe literally too. But the point is that they embraced that this was a change in their life. And oftentimes this goes hand in hand with maybe a spiritual shift, something where they're pursuing meaning in place of cravings. Either way, we are here to help you on your journey. Reach the success that you want. Let us know if we can help you.